Welcome. Thank you all for joining us. All right, so we have a couple of housekeeping things that we'll go over here shortly. Welcome. All right. So this is the panel for how to make crisis continuum services responsive to families experiencing crisis. And so we'll go through some housekeeping things in regards to what to expect. I'll introduce the panel and we'll get to hear more from them as we move forward. So if you have any technical difficulties or connection issues, this should be shared in the chat box as our C event personnel, Marcus, will help support you in fixing if there's anything that comes up. So feel free to make sure you use the chat box for that. So today we have Shelly Keeble, Sydney Bice, Brenda, Natasha, Miche, who will all be sharing from a lived experience perspective of how the crisis continuum services respond to families experiencing crisis. And I just want to explain that the chat box is for questions to speakers, which will be shared at the end of the session. Participants will be invited to participate through Zoom emoticons. So that smiley face that you see on that bottom border, feel free to, yep, thumbs up, I see you, David. And so feel free to use those, the heart emojis, the celebrations, when you hear something that you agree with or experience. I think that's great. So feel free to use that. I want to remind that everyone's microphones are off and this session is being recorded. And at the end of our panel, we'll be sending out a survey in the chat function. We'd like you to fill that out so you can provide feedback. This training is being offered through the Crisis and Recovery and Enhancement Care TA Center, which is funded by California Department of Health Services, DHCS. The views and opinions and content expressed in this presentation do not necessarily reflect the views, opinions, and policies of California Department of Healthcare Services. In the case of any security issues that may occur, this session will immediately end and will not resume. A separate email will be sent to participants with further instructions. Thank you. So you're welcome again to use the chat box. Please use I statements in the chat to avoid making any comments that are stigmatizing or otherwise injurious towards people. If you need support at any time for difficult feelings, please exit from the session and go to the Feel It to Heal It room, where you can access crisis and warm lines and other supportive resources. As I mentioned before, we appreciate you all for being here. And so now it's time to begin our panel. We're going to give our panel each panelist time to introduce themselves, and I'll go ahead and call them out by name to introduce themselves. And we'll go ahead and start off with Miche. She'll introduce herself, and then we'll get into some questions.
Yes, thank you, Christina. And yeah, so my name is Miche Venerable. And I am a youth advocate at Stanford Sierra Youth and Families.
Brenda?
Hi, everyone. My name is Brenda Taylor Jackson, and I am the guardian of my grandson, and happy to say he was recently reunited with his mother and soon will be 18.
Thank you, Brenda. Natasha?
Hello. Hi, my name is Natasha, and I'm a mother of two girls, young teens.
Shelley?
Hey, my name is Shelley Keeble. I'm also a family partner with Stanford Sierra Youth and Families. I'm here as a parent of a amazing transgender son, and here to share some lived experience with you around our experience in dealing with crisis services.
And Sydney.
Hi everyone, my name is Sydney Bias. I'm a Family and Youth Partnership Coordinator at Stanford Sierra Youth and Families. I'm a mother of two, and I'm here to talk about my lived experience personally with the mental health system.
Well, for taking the time and introducing yourselves and sharing a little bit of where your lived experience is going to be coming from when answering these questions. At the end of our presentation, we'll leave it open for if there's any questions from the audience that they would like to put in the chat box. We will go around, 15 to 10 minutes at the end of the session, and we'll go to those questions. So our first question is to the panel. Can you tell us about what systems you utilized during a crisis and what worked?
Well, for me, Stanford Youth Services was a good resource for me and my family. And also having my healthcare coordinator through the Sacramento County.
Hi. For me, the experience started from another state. We did a state-to-state relocation through CPS. And the process with CPS was the only thing that we received to get our grandson here on an emergency basis was a suitcase. So basically, my husband and I had to do our own research. And thankfully, we lived across from the middle school. So the school system was one of the resources that we used, one of the services that we used. And so that was very helpful, but we had to, again, do our own research, and there we were referred from Lily Children's Services to Stanford Youth Solutions.
So I utilize, I have experience utilizing the 911, calling 911 a handful of times, the suicide prevention hotline. Those are the services I utilize in crisis. However, those weren't entirely helpful for me. It was more so what I was referred to afterwards, which was a DDIOP program, which is dual diagnosis intensive outpatient program for people with substance abuse and mental health challenges. And they really had a big emphasis on making sure that your natural support systems were strong. So after having touched several people, the thing that ultimately helped me the most was having a strong natural support system and having people in my own life that I could connect to rather than all of these health professionals that weren't too helpful for me to begin with.
Thank you for sharing, Sydney. And so I just want to maybe get some more details from Brenda and Natasha around what specifically worked within those systems that you were experiencing that crisis.
For me, with the Stanford Youth Services, seeking the counseling that they did with my teens, and actually they had resources within their system that kind of branched out and helped my girls to other programs and other things that can help them. So that was a big part of it that helped a lot.
From my experience, it was beginning at the school system where we were made aware to do an assessment on our grandson at such a young age, and he started out as a 504. When we relocated him here in Baltimore, we did an IEP assessment, and it was through the school system. Mind you that we had to be not aggressive, but we had to do our homework. with the school system, and going through that, we had to go through the Folsom Cordova Unified School District, which connected us to Warmline, and also through Stanford, which taught us the skills and the tools to address those crises when it escalated. So not just Stanford Youth Solutions, but we had to be visible and be an advocate for him at the school system. So we had to be visible and to be an advocate for our grandson through the IEP, and to make sure the IEP was addressed and it was followed through. So the school system was a positive, and I'll talk to you later about the other experiences I had with the school system. So it was very helpful to a point.
Well, that's going to move us right into what didn't work when you reached out during a crisis.
My experience in reaching out for my son, he was having he was already in mental health services. However, he did reach a point of crisis, engaged in some self-harm, had some suicidal ideation, which was obviously very, very frightening for us as a family. We reached out to the therapist, who reached out to the psychiatrist, who reached out to my son's primary care doctor, and they decided it would be in his best interest to remove his hormone replacement therapy until he was more mentally stable. At that point, everything fell apart because they had taken away the medication that was helping my child deal with his gender dysphoria. He had not been out for very long. His suicidal ideation was kind of related to his gender dysphoria. He was a boy who still had breasts. It was hard for him. And what didn't work was the fact that when we finally got into, they sent us to be evaluated for either inpatient or outpatient services. And my son was tasked with the burden of educating the intake coordinator about trans healthcare, the definition of gender dysphoria. He had the burden of educating them, which was really difficult and didn't work for our family. We as parents, we're still learning. So watching our child in a time of crisis where all he wanted to do was not be on the planet anymore, it was really difficult to watch him deal with that. So that definitely didn't work.
For my experience, first with the school system, it was that the stigma of mental health was not made aware to the point where they would stop bullying and address it. And so the trauma that my grandson went through was not only that he was relocated because no other family member would take responsibility for him. And it was because, and also he was being, we were raising him and we're his grandparents. And so with that comes the questions from children who can be mean, people, and not just children, they can be mean. And so they looked at him as being a bully and not addressing why his behavior was changing and it was becoming aggressive. So they treated it as a behavioral problem, not addressing why the problem was happening and why the behavior was happening. It wasn't until we pursued it and we had to be firm, being an advocate on his behalf. And it's not saying that we were allowing him to be a bully, but we needed to address it with the staff, the counselors, and everyone. Why? Because once they are in, our grandson was in special ed, again, that leaves it to open for bullying. They were teasing him, and which in turn changed his behavior. And so they looked at it as a behavioral problem. And so from the school district, from the middle school, we were approached at one of the due process meetings with the superintendent and the director of due process. And the first thing out of his mouth was, oh, you will not act like this if you make it to high school, because we don't use security, we use police. And mind you to say, his behavior reflected racism, and I'm gonna say it, it was racism. And he judged him before even finding out, talking to him, his whole demeanor changed. And the experience that we had dealing with this caused me to go to the district. And so we put in a formal complaint, and I talked to the one of the employees, I cannot think of her name, but through Warmline, and they were very helpful. But you have to be an advocate, and you have to fight for the child, or they won't, because they're not aware or they don't know how. And so, to make a long story short, with this experience, it wasn't just seen by us. It wasn't just us. The whole, those that were in attendance saw it, and it got to a point where this gentleman ended up resigning before he got fired. And even the one who took his place was in a meeting, and they ended up apologizing because we wasn't going to let it go. And so by them seeing it, well, we had to take it further. That's when some action was taken. And so instead of them looking at his medical history, they didn't, an incident happened, a crisis happened, and it wasn't handled. And this is where the police took over. And the police, thank goodness, one of the police officers in our community knew him and knew his situation. So she was able to de-escalate the situation. And the other police officers were ready to arrest him instead of de-escalating it. And I'm thankful to her to this day, because it could have turned in a whole different way. And so that paid off, getting to know your community, getting to know your police officers, making them aware of the situation. And we were involved in the sports and everything, being visible at school, and they knew how to handle the crisis. And so with the IEP, that's what we had to stipulate things and make sure it was enforced with the school system and the district, also with the judicial system. So those were the issues that we had.
Thank you for sharing. And I mean, and just hearing Brenda, you advocating for your grandson on multiple levels, like there's school administration, and then there's the resource officer that you had to build rapport with, really just to connect with, to make sure that if anything did arise, right, that there was a plan of action. And that's not working, like when we have to work that hard sometimes within systems, right, versus these systems of care that are set up to support us. And it's the same for you, Shelley, when you shared about your son having to educate the professionals in the profession. That's, you know, tasking our young people who are in crisis to have to maybe step outside of themselves, which can be even more stressful. It's not exactly fair. So we're going to go ahead and move into the next question. And the next question is what do you feel is missing from the crisis response system?
Right.
Go ahead,
And yes, I actually want to bounce off of what Brenda was saying just about the school system. And I think this is connected to what's missing in crisis response systems, which there are crises that happen at schools all the time. And teachers, staff, administration, a lot of what's missing within that too is being having a trauma-informed response, especially on school campuses with police presence. That, you know, there are students who get arrested for having behaviors that, instead of understanding maybe why the behaviors are happening the way they are, and just understanding the need to, we are just jumping into, hey, yeah. And if it's a Black student or a student of color, you know, they're now like a threat. just because of the stereotypes that are related to being a Black young male. And, you know, that's why we have the school to prison pipeline, which, you know, needs to be destroyed. And so, you know, if there's a lot more trauma informed and any mental health training that's available to administration and school systems and in police systems, especially when there's really only one type of, when we're having a crisis and we need to call somebody in an emergency, really the only option more times than not is calling 911, which can be harmful into a lot of communities.
Thank you for sharing, Michelle.
I want to bounce off of what Michelle said, is having that, like, if you're dealing with people and working with people, like whether you're in school, whether you're a nurse, a doctor, or law enforcement, like, you need to be educated on mental health and how to work with people and how to help de-escalate them. Me personally, I've had experience with law enforcement, not helpful at all. Didn't know the difference between suicidal ideation and intent to harm. I've been picked up by first responders that were telling me on the way to the hospital, you know, if you just take your medication, you wouldn't be here. I don't have medication. There's a reason I don't take medication. And for someone who has no experience with that to tell me that was really frustrating. Like, you don't know anything about, like, that's me and my psychiatrist business. So it was really interesting to hear that. And then going to the hospital where nurses were just constantly like asking me, what happened? Why are you here? Just for the sake of being nosy, like, not because the nurses aren't the ones that help you take the next steps with what you need to do to get back up on your feet. It's the social worker at the very end of that long trail of service providers that you're meeting that's going to help you with that. And so having 911 being the only option is really frustrating. And if that's not the only option, more education and awareness that there are other options. Every therapist I've ever had has always told me, if you are in crisis and you can't keep yourself safe, call 911. Never have I ever been told, here's something else you can do or call, or nothing. So if there are other options out there, why aren't they being communicated across all platforms? And so just making sure that everyone is aware, if you're working with people to this capacity, you know, make sure that you're mental health aware and how to support people properly.
One of the instances that we had with the school system, well, I think a de-escalation room. And so we were suggesting that with our grandson's situation, instead they sent him directly to the hospital. He had a cut on his hand because he was throwing things. And so he ended up hurting himself. And the reason he was throwing the things, because he had to get the energy, he had to get the anger off of him. And the school didn't understand that. So one of the suggestions was, we need an escalation room, a de-escalation room, and have the properly trained staff. When he was sent to the hospital, they put him directly into the mental health unit where there were adults. And I had a fit because he was among all of their population. They're running the halls. He's watching this, and I'm not knowing what's going through his mind. And so one of the suggestions with the school system was to have a quiet room, because a lot of kids cannot take the stimulation. One of the things we found out was that at the age of 12, he can refuse counseling and he can refuse medication. And that just took me for a loop. So, of course, he refused medication. So I don't know, this has been a while because he's now 18, if this has changed since or what. So the medication wasn't helping him. But the one thing did was I asked him what helps him. So communication with him was very key. And what we found out was that while he's in class, when kids are asking him, why your grandmother here? So that's trauma because he has to relive why he's there. So he has to repeat that, like Sydney is saying. And so we were suggesting that, well, we did put it in place on the IEP that if he feels himself getting escalated, that he can take a 5-minute walk. Now he's still accountable for his schoolwork, but he can walk it off. He also, we found out that, what is it called? Mountain Dew helped him. So he was allowed to carry a Mountain Dew with him. So those specific instructions on the IEP, the school has to follow. So it's important that when you go to those IEP meetings, to stress what works for your child or for you, Sydney, what works for you and what's going to help you, and hold them accountable to follow it through. And that came directly from the school board and Warmline.
Thank you for sharing. We're going to go ahead and move into our next question, which is, and we'll start with Michelle. Do you see any need for more culturally responsive support to be in place when in crisis? And what would that be?
Yes, absolutely. And I think it ties into all of the stuff that we were talking about, especially related to 911 responding to mental health crises. I mean, when you're, being culturally responses in instances where police are called on a Black or brown person, right? And because of stereotypes that exist, they may be in a place of where they're harmed. And if officers, if law enforcement isn't culturally, if they're looking at them as a lens of just being a threat, then obviously it's not a safe environment anymore. So I think in that instances, having obviously just trainings related to cultural responsiveness, and yeah, trainings that would be helpful.
Shelley, I'm wondering if you can share from your experience with your son, how systems could be affirming and culturally responsive to his needs and transition. And then what would that be?
I think it would take the form of educated and trauma-informed providers. That seemed to be the biggest barrier for our family, was that the providers just didn't have the education, didn't have the know-how to treat him. In talking about whether or not we were going to have him go to inpatient treatment, there was this big thing about, okay, can you tell me where my son will be housed? Because I know that can be an issue. Are you going to honor the fact that he is a boy and put him with the boys, or are you going to go by his assigned gender at birth and put him with the girls? And they couldn't tell me. So as a parent, I was just horrified that there was no answers. I just felt like I kept asking questions and asking questions and asking questions, and the answer was always, I don't know, or what does that mean? It did not. I had no confidence in the system of care at that point. So I do think being more affirming and culturally responsive for our family would look like just having that education piece, a bit more compassion, and possibly, I think what really would have helped was having somebody who had been there, somebody from the LGBTQ community as a provider, to support us kind of through that process, because it was evident the providers we were dealing with had no clue. So I think I think that's all very important. Working where I work now and knowing that like family advocates are a thing, youth advocates are a thing, would have greatly improved our experience in services, having somebody with that lived experience to kind of walk us through those systems and help us access the resources that we needed, not the unresponsive care that was dumped in our lap, would have been very helpful. I think it would look a little bit like that.
Thank you for sharing. Would anyone else like to answer this question of, do you see any need for more culturally responsive support to be in place when in crisis? And then what would that be?
I think in addition to the trainings that would be offered to people is what does the accountability look like when people aren't being culturally responsive? And, you know, because we could train people all we want, but we need to make sure that that's like a constant thing and not just a one-time thing and you're all good to go. Like, are these conversations happening at a consistent basis? And when people aren't being culturally responsive, are they being held accountable within a reasonable amount of time? I understand when things get really serious, there are investigations that happen for a long time. But even then, like not weeks later, not months later, immediately, what are the consequences of poor decision making and bias? So I think accountability when expectations aren't being held standard.
Thank you for sharing. And it would be helpful, right, to know that you give feedback and that the feedback doesn't land in a hole somewhere and not resurface, or changes aren't implemented in a way to be supportive to the community it's serving, specifically when we're talking about culturally responsive and system changes and things like that. All right, our next question is what services or supports were you linked to that you found helpful after crisis?
For me, we were directly linked from CPS, and as far as the prior question, there also should also be some changes with the navigating through CPS and state to state, because it's becoming more common that children are being relocated state to state. So the other two, what was the question again? I apologize.
It's okay, Brenda. It's what services or supports were you linked to that you found helpful after crisis?
Okay, so after crisis, well, when we received Terrell, I did the Google search, and it was through Lilliput Children's Services for the guardianship. They were great with navigating for the IEP process, and they were right there with us. They even had a representative to go to court with us. And they were the ones that referred us to Stanford Youth Solutions, which I applaud, because not only do they address the children and the teenagers, they address the caregivers and the support that we need, and to know that we're not alone in this and that we have a voice. So I do commend Stanford Youth Solutions, and they give us the platform and the format and the time to have a voice and to make changes. And even when our children are having crisis there, they have the family support system there, and the support groups. And my husband realized that they needed to have more men involved. And so he's been pushing that, and they're open to having more men, and that way we're having dinners, and so we're making it so, and encouraging everyone that is going through a crisis, or as a caregiver, a parent, to come out, because you have to have that support. You have to be able to vent and cry and fuss and learn. And I can say that we do learn the skills and the tools to handle the crises and to get a better understanding of the mental challenges.
Thank you for sharing.
I'll say really quickly that I wish we had resources after the crisis. In our case, I kept my son in the intensive outpatient program in order to get the okay for him to have his hormone replacement therapy back. The program itself was incredibly transphobic, using his birth name to label his cell phone, trying to force me as a parent to sign him in under his birth name, misgendering him throughout the day, which ran from 8 a.m. until 3 p.m. I didn't know any better. So I went with it because I really believed at that time that the professionals knew what they were doing and that that was the route I had to take to get his life-saving medication back in his hands. However, that did happen with some advocating on my part and his father's part towards the end. That program ended for us when I went to pick him up one day, and they said, your insurance didn't authorize any more days, so goodbye. No safety plan, no treatment summary. I had not even met with a counselor, the psychiatrist, the medical doctor that was providing care for my son. We hadn't gotten to that point yet. So they didn't link us with anything. They just kind of sent us off into the world. But what I can say that worked for my family about this whole entire process was that it turned me into a fierce advocate for my son and other LGBT youth. So it wasn't all bad. In the end, it turned out to be a very, very beautiful thing and strengthened our family.
Thank you for sharing. All right, we'll move on to our final question, which is if you could improve safety planning, so planning with your treatment team before the crisis hits, what would be included in that?
I think that having really clear communication, transparency, and follow-up with families when doing safety planning is really important. Like, well, I hope that's there first. But like, if the family isn't comfortable with certain things in their treatment plan, or it doesn't work, that obviously should be part of the planning too. I mean, I'm just thinking about like an example where we had a family where calling law enforcement when things are really escalated, that was something that they did want, and something that we continue to have on the treatment plan when, like, in the middle of that, they realized, well, this isn't very helpful. And then even halfway through that, they said, hey, this isn't helpful. But still, sometimes the police were called. So even being really clear about, okay, this may be the case, and this might have worked before, but now this is, what would be better. So short answer, follow up and communication.
Thank you, Michelle. Brenda, do you have any thoughts on if we could improve safety planning, what would be included?
In safety planning, I would say to think first before you act. And so most of the time when we have a crisis that arises, they're quick to act on the behavior and not acting on why the behavior is happening, or taking the time to know the history of the individual, or getting data, information about this person. I would say, and also with the police department, with the judicial system, again, get to know your community, get to know your surroundings, try to be proactive, where a safety plan is ineffective. And like Sydney was saying, hold them accountable. And so many times that the judicial system, they'll say, oh, we've had training over and over. But we were told by the police officer that we know personally, she said, oh, we're taught to shoot first. And so I think that has to be addressed. And those actions that are not taken, they have to be held accountable. Also for safety, I would say, just like with Shelley's situation, she already addressed it, as far as having someone that's familiarity, lived experience. And so we've been talking about this for such a long time that we have to be accountable for ourselves. And so it was a saying that I heard at another conference, in fighting monsters, don't become one yourself. And so we have to be sensitive enough and respectful of each other. Justice for all is not justice for all. And as they say, Black Lives Matter, white lives matter, all lives matter, but they don't. Do all lives matter? No. And we have to be realistic. And so with those safety plans, whatever comes up, we have to hold them accountable before it's too late, before they shoot first and ask questions later. Get to know the history, because even after, with our grandson, we are afraid every day because of his color, and he's a young Black male, and anyone of color. We don't have that privilege. And so every day our lives, and not just with color, with gender, with Shelley's son, all of that, we have to think first before we act. But we have to get those that make the decisions to think and act or be held accountable. So anything that's safety wise, I feel bad that we have to teach our grandson when he's approached by a police officer what to do. I never thought I would have to see that in this day and time. So we have to prepare our children, just like with Shelley's child, just with Sydney. We have to, and Natasha, we have to prepare them, give them the knowledge for their own safety and their own lives.
And Brenda, I think what you're talking about is safety planning outside of, like, even within and outside of that treatment plan, right?
Yes.
Is that we're incorporating some of that, how unsafe it can be when we have, certain response teams, right? Especially for our youth of color, when relying on certain systems to respond. So building that into safety plans where there's treatment teams so that we are more cognizant of that, what that looks like.
Yes, yes.
Natasha, is there anything you would like to add in regards to information to add to the safety plan? You'll have to come off mute.
There we go. Oh, okay. Can you hear me? I'm so sorry.
Hear you now.
Hello? Okay. Sorry. Yes, I know I haven't really spoke much, but aside from the Stanford Youth Services, when I was linked with my healthcare coordinator, she was also resourceful too. And it kind of just gave me some self-knowledge too, because I was able to get some help just so that way I can help my children. So just having that available to me, so that way I can educate myself, and that builds me up to basically be a better person or advocate as a parent for them. So that's really helpful when you do get that type of help, because you can also spread that. So yeah, I do feel like with those two support systems, they helped me a lot. And if it wasn't for my healthcare coordinator, things could have gone really in a different direction. So I was really fortunate for that, and for her being a support system for me and my family.
So, take it. Sorry. Thank you for sharing. I mean, I have, little people who are at home and this is what it looks like, right? So thank you for being patient and graceful because, if the baby's not crying in the background, we got a 4-year-old who's trying to charge an iPad, all that jazz. So thank you, Natasha, for sharing. I think that is always helpful to hear how, who, and what is helpful in trying to help us as parents be better parents to help support our kids who may be struggling with some mental health challenges, right? And even ourselves. So I greatly appreciate you for sharing. I'm going to open it up for the panel to just openly share final thoughts. Any final thoughts you have in regards to how crisis continuum services responses to families experiences this crisis can be better developed, supported. Just some final thoughts before we open it up for questions.
I would say, and I know I'm trying not to be long-winded, I would say get involved with your judicial system and your legislature in the community. Be a voice. Be a voice of what you want done. And so get involved. There are so many organizations out there that are connected with writing bills and getting bills passed, as far as like Day at the Capitol. And so look into that. Find those organizations and that in your community that gives you a voice and be visible in it. So your legislature is so important that you get the word out to your assemblymen and your congressmen, and just realize you have a voice.
I totally agree with Brenda. I'll just add that I do think as a community, the more we know, the more we share, the more we advocate for each other, the better systems of care will be. If we all know that advocating is even possible. I didn't know that it was possible. I did not file a grievance with the intensive outpatient program for about 8 months because it never occurred to me that I could. I didn't know. Now I do know that, and I can say that the psychiatrist who asked my son repeatedly, how do you know you're trans? How do you know you're trans? Are you sure you're trans? Did you feel like this when you were like 3? Because if you didn't feel like this when you were 3, then, you're probably not trans. I'm proud to say that with some effort with myself and some other families, she no longer has a license to practice. I didn't know things like that were options. I thought you just had to kind of take what you get. I didn't know you could swap providers. So I think just as a community, kind of lifting each other up and supporting each other is how that change is going to happen. It's going to come from us and go up, not from the top coming down.
I think Brenda and Shelley have really, really good points. I think that there are some people out there and some people with certain professions that think they know it all and think that, they hold everything when it comes to, educating others, but you can really learn from the people you're serving and from one another. And everyone here today, and even the people that you would advocate for, like there is always space for someone to learn something, and it's really harmful if you operate from a consistent place of, not being receptive to getting better at what you're doing and to, better serving the community with the different feedback you're giving. So just constantly learning, constantly advocating, and constantly being a voice for people that don't have one for themselves.
Thank you all for sharing. So I'm going to open it up. If there are any questions for our panel, please feel free to put it in the chat so that I may ask them some questions. I also want to acknowledge that coming and observing a panel, particularly on the topic that we're covering, it might not invoke a question, but it might invoke more thoughts for you to take later. And so if you don't have a question, you don't have to have a question. But we appreciate you for joining us, and I'll allow some space if anybody wants to write anything in the chat. With that said, I will ask Marcus to put in the feedback form so that you guys can take a look at that and provide some feedback for us. And we just dropped that into the chat, so feel free to take a second and get that done. But if there aren't any questions, we greatly appreciate you for joining us and listening to our panel and their experiences. Oh, we have a question. What ways can I encourage clients to come in with solid safety plans, to come up with solid safety plans?
I think encouraging them to create a safety plan that's helpful for them, because I've sat with therapists who constantly push me to create a safety plan that I won't actually use or go to. They just want something to write down. So really encouraging them to think about what would be helpful for them when they are in that deep, dark place. What would be helpful for them to go to help get them through that, or to help keep them at their baseline, or help out. Just making sure that's very individualized to what that person needs, and not just writing down whatever just for the sake of putting it in.
So Sydney, I'm wondering if you can share, because I can imagine when trying to help someone develop a safety plan, what types of questions would be helpful to hear when someone is in a space where maybe they can't find the words, or like what would help invoke some conversation?
I mean, I can only speak to my experience, so I'll talk a little bit more about like what that was like. My therapist was having me write down people that I could go to if I felt like I was not in a place to keep myself safe. And at the time, I did not feel like I had people that I could go to, like specific people I could go to talk to when I was in a space. But she was very persistent on, no, you need people to go to. But I just was not at that place yet. So something else, like what is something that I could have done individually by myself that could have helped me keep me at baseline, because it was go to people that I would never actually call, or call 911. And those are my only two options. So maybe, just talking with me for a little bit longer and just figuring out, what is something that I like to do by myself, or how could I help increase my natural supports? Yeah, I'm not sure if that entirely answers you, but for me, that would have been helpful, not to be forced to put down random names on a paper.
No, I think that's really helpful, because I think sometimes we can get caught in practices and answer, ask a standardized question and not realize, oh, that actually doesn't work. And so can we even open the box more, right? So if it's not a person, are there things that you can do? All right, in the chat, we got a thank you to all the panelists. I have a question for Shelley. Is there one question that sticks out for you that you think should be asked of a family on a journey similar to yours?
I think the first thing kind of revolves around pronouns, and asking and sharing your own pronouns, which I didn't share mine at the beginning like I usually do. But just that question about pronouns and gender identity. Who are you? How would you like me to address you? Which goes for all people. I think that's where the discussion starts when it comes to crisis care, and where it would have definitely kind of made my son feel like he was being cared for, and the operative word is care. And feeling cared for is a big deal, especially for, at the time, a 15-year-old child. He was still a child. So I do think starting out with the pronouns and just realizing that you have to meet these kids where they are, not where you wish they were, not where you hope they will be, but where they are right now.
Thank you for sharing. Are there any other questions from the audience? For Michelle, as a Black woman supporting youth in care and navigating multiple systems, what is one thing you think is most helpful for clinicians to do when meeting Black youth?
Right. Wow, and meeting Black youth. Well, I'd hope that they wouldn't assume or like, Can I can't see the questions. I don't know if they're in another tab or, oops, and I have some feedback. Do you mind like dropping the question?
Yeah, I will, let me see, let me send it to you, but let me ask it again.
Oh, okay.
So as a Black woman supporting youth in care and navigating multiple systems, what is one thing you think is most helpful for clinicians in meeting Black youth?
Most helpful. I would, that's a good question. Oh, thank you. Yes, okay. I would say, meeting Black youth. I don't know, actually. Most helpful for clinicians to do. Like, I hope if I were a youth and I had a clinician, I would want them to, not treat me differently. I don't know. Can you clarify like a meeting, like the first introduction, or
Well, think about it. As a youth advocate, you're sitting down with one of your youth that is Black, and they're about to meet their clinician for the first time to have maybe a one-on-one session. What are you hoping the clinician does to be culturally responsive and to meet their youth where they're at?
Oh, here we go. Yeah, okay. I see another chat too, to not assume their experience and to listen and validate the personal experiences, which I definitely agree with. Just, yeah, not making assumptions.
All right, we're at our 5-minute warning. We can take one more question if anyone has one. As my kindergarten teacher would say, going once, going twice, going chicken soup with rice. And if it doesn't look like that's happening, but we got a good thank you to all for sharing your experiences and your thoughts and how we can improve our crisis response for families. We appreciate you all for attending and listening to us, and major thanks and big thank yous to the panelists who were vulnerable with us, who shared some of the challenges that they've experienced, and hoping that everyone can learn from that. Thank you all. Have a good afternoon.